XAMPR is your answer to the prayers and cares for your loved ones. XAMPR provides end-to-end collaboration between doctor, nurse, hospital and patient's families, so that the patient receives utmost care no matter where. Meet Jennifer, a 12-year-old girl who is suffering from lung cancer. She has undergone her third chemotherapy. Her doctor has suggested home care as forwarding care advice. Meet Linda, the hospital admin. She adds the patient to XAMPR Homecare Suite with the click of a few buttons and completes relieving formalities. The treating doctor is assigned to the patient, and a home care nurse is allocated to the patient. A list of necessary equipment for home care is also updated. Meet Dennis, the doctor. He uploads the prescription for the nurse to follow every single day. He also includes instructions on diet and exercise. He creates a checklist of tasks that the nurse should follow while caregiving. Meet Emily, the nurse. She is assigned to the patient, and she receives medication instructions via her XAMPR app. She has access to all of the patient's records and reports. She takes note of all the medication timing, administers the drug, and keeps track of all activities well in advance so that no medicine, no diet or physiotherapy is missed out. The nurse enters the necessary vital statistics like BP, sugar etc. at regular intervals as instructed by the doctor. The doctor receives the vital stats of the patient on his dashboard as a steady update in the form of a live graph. He can see the real-time values fluctuating on his mobile screen. Based on these readings, the doctor decides to get some lab tests done, and assign it to a particular lab. He also decides to change some dosage in the prescription. The nurse receives the notification for lab tests as well as the change in prescription. She wants to understand the new dosage correctly and decides to chat with the doctor. The nurse takes the patient's latest pictures and shares with the doctor for a more accurate diagnosis. She also shares some observations she made in the notes earlier in the day. The lab assistant receives the test request on their XAMPR home screen. After accepting it, the lab provides the address and the test time on the app, and uploads instructions to be followed before the test. As the reports are generated, the lab uploads the reports, and the status of the test reports are made visible to the doctor, nurse, and the hospital. The nurse schedules a consultation with the doctor to discuss the test reports. The patient's reports will be attached to the consultation. The consultation will appear on doctor's calendar and he can update his availability. The doctor can also request other treating doctors for advice. 2 weeks later, Jennifer experiences breathlessness and is perspiring profusely. The nurse raises an alarm to notify the doctor and the hospital that the patient is critical. The doctor, upon seeing the critical alerts, instructs the hospital to send an ambulance immediately to get the patient. Also, he leaves a set of advice for the emergency team that will be receiving Jennifer as well as the nurse involved to ensure a total coordinated effort. The emergency staff confirms receiving the patient, and informs that she was having chronic sinusitis. Fortunately, the nurse was able to notify immediately, and with the doctor's prior instructions, the emergency staff was able to save Jennifer. This is how HIPAA-compliant, XAMPR Homecare App is crucial in managing, coordinating, tracking, and taking care of all patients' needs, right from the hospital to their home.